You're welcome to Perfect Lab Manager. Today I'll be taking you through the working space or the interface. We'll be looking at the various features that the software or the platform brings to our businesses or our laboratory facilities, and then we'll see how best we can take advantage of these features. So Perfect Lab Manager is a comprehensive lab management software that is designed to help with the day-to-day operations and management of a medical laboratory facility. We understand the growing demand of medical laboratory and diagnostic facility, and then the complexity and then diversity of such business. So the platform provides a comprehensive solution, whether the facility is running only a medical laboratory test or is doing medical laboratory tests plus other diagnostics like ultrasound and then ECG. The software comes in handy as an all-in-one, complete one-stop solution to all that. You don't need multiple software to be doing that when you are using Perfect Lab Manager. Now, this is a landing page, or this is the main page. So when you start the application, this is where it takes you, and this is where you have to put in your user information to gain access to the main platform. You will have to select the branch you are logging into. That is, if your facility is a multi-branch. If your facility is a single branch, you only will have one branch showing here. So if we had multiple branch, under the select branch option, you have multiple branch or the names of all the branches that you have. For demo demonstration, we're dealing with the main branch. So it's presumed we're dealing with a single facility with no branches. We'll put in our user information and then we'll log in. That gives us access. Now that brings us to the main platform where we have the name of the medical laboratory shown as this is a demo medical laboratory. It welcomes you, it gives you your last login details, and then your current time tracker to help you track your time and activity. Now we'll go through the features that this gives us. Now on the header, you will find the name of the software. There is a navigation bar that helps you to go through the menu. So when you click on the navigation bar, you have the main menu that pops up for you. At the right corner of the header, you will have your name as you've been assigned, and then there is a notification bell that gives you notices when they are in. So when you click on the notification bell, you have your notice board that pulls up for you, and if there is any notice that has been sent from the management of your facility, you will get those notices shown here. Now on the main menu on the left side, we have the front desk feature or model. We have the billing model. We have the test processing model. There is a test analysis model. There is a results validation model, test report model, inventory model, setups, configuration of test, human resources, finance, and then you have the notice board as well and your sign out button. Now we'll go through the various models and see how we can use them to help our business. But before that, we need to set up our environment. So we'll go to setup, and then under setup, we have setup business, add branches, setup department, add doctors, setup expenses categories, and then add service providers. Now we'll begin with the setup business. That is if you want to put up the business information on all that about your facility. So you click on setup business. That takes you to the setup business page. You have the business name in first part of it and the second part of it. You can also put them together. So our business name here is Demo Medical Laboratory. We chose Demo as the first part of the name, and then Medical Laboratory as the second part of the name. It could be Demo Laboratory, or demo medical as first part and then laboratory as the second part. You could also put demo medical laboratory together as only the first part and ignore the second part. It will still work. Then you will have to provide your business address. So we're looking at address, say Damango, and then the physical location along the Solar Main Road. We will also have to provide the contact information for this demo facility. So we're choosing this 024 as a contact information. Then if there are more than one contact information, you can add alternative numbers. You need to also set up your email for communication. So demo@perfectlabmanager.com. And then if the business has a website, you put the website in here. Then you have to choose the logo for the business. So we will attach our logo here. We'll go in and look for a suitable logo for it. So demo, and then we add in. Then we can update our business record. We're done with the business setup. Now let's go in and look at adding branches. So if we sign up for multiple branch, we can then add more branches. But because we are doing a demo, the demo is set up for the startup, which only allows for one branch. So we are told you can add up to one branch. And then that limits us to the number of branches that we can add. And because of that, the form here, there is no button to click to save or add the information you put in here. So if you sign up to our startup package, you only can use it for only one branch. If you sign up to the other packages, you can use it for 2 or 3 or 5 or unlimited based on the subscription you sign onto. Now let's look at the other features there. So setup department. When we go to the setup department, you click on that, and then you have the various departments that your lab runs. What we've done is that we have put in these basic templates as common department we have in the laboratory. So there's a hematology, there's a chemistry department, microscopy, serology, microbiology, endocrinology, and then imaging. You can change and edit them the way you want it so that it will suit the one that you want. Once you click on it, you have the information here, and then you can begin to edit them the way you want it. So chemistry, we can put the description here. This department handles all chemistry tests, right? And then we can update that goes into our records. Now, if we check on our department, we have the department ID, the name of the department, the code for the department, and then the primary tube and then the secondary tubes. Now, what we do here with Perfect Lab Manager is that we make sample collection easy so that when you have a test assigned to a particular department, at sample collection point, the color of the tube you choose for primary tube is what will show the person taking the sample. So that if the person, excuse me to say, forget about what tube or is confused about what tube to use for which particular test, because you have set up primary tubes for each department, based on the test that had come in, the system will suggest the tube color, and the person taking the sample will then know. If the primary tube is not available, there's always an option for the secondary tubes. So you choose the color of the test tubes or the sample collection tubes for each department, and then will help in the sample collection. We'll come to that part when we go through the operation aspect. Now we go to the other part of the setup, that is add doctors. So we'll click on add doctors. This is where we add our doctors who refer cases to us. And then it helps us to track the number of cases each doctor is referring to us. And then if we have a reward system or a commission system to reward or pay our doctors for helping or partnering us in this business, then we can get full data on those activities and also reward them accordingly. So to add a new doctor to the list, you go to the add new section where you choose the title of the person. So doctor, we're choosing the name as Dr. Dan, and the ID will be DD01. You can choose any ID for him. Then you put his phone number. Let's use 0249066767. And then the email of that doctor, drdan@gmail.com. You always ensure the email is valid because when it comes to communication with your doctors, you need their telephone numbers and email address to do so. Then a specialty, you choose a specialty of the doctor, whether it's a cardiologist, whether it's a nurse practitioner, urologist, pediatrician, a general practitioner, you choose it. And then the facility the person works from, there's a list of facility provided for you, but you can also type in your own. So Damango Government Hospital. And then the status, you put the person to active. Then the username and the password. These are credentials you give to the doctors to be able to access the platform so that if they have sent a request to you, they can also have access to the patient report, not the test process, but the patient report whenever it is ready. So they can also track the number of cases they're given to you or can communicate with you when they need be. So we're going to give a username, Dr. Daniel or Dr. Dan, and then we give him a password, doctor@123. Right, so remember that the username is Dr. Daniel and the password is doctor@123. When we get to where the doctors access, we'll use this username and password for that purpose. So we can now submit, and then we have the doctor's information put in there. So once you add more doctors, you have the list of the doctors that you have in there. And at any point in time, you can use this search test here to search for the list. If the list are many, you can scroll through them. You can always search for it from here. Right. So we've done the addition of the doctors. Now let's move on to, we'll skip the expenses category for now, and then we'll look at the service providers. So you click on the service providers, and then you are given a form to add a new policy. So the service provider, we're looking at Acacia Health Insurance, and then we're going to give Acacia Health Insurance, and then we put this is Acacia Health Insurance Scheme. You can put whatever description that fits them, and then you set up in there. You can add many policies. So we can add National Health Insurance Scheme, which is NHIS, and then we say this is the National or Public Health Insurance Scheme. And then you submit. So you have two policies in here, or private providers, that is Acacia Health Insurance and then NHIS. So if your lab allows NHIS services or you receive NHIS clients, then you can use, or any other private client you can set up. I must say the other private laboratories have their own platform for validation and do not allow developers like us access to it. So if your develop or your policy provider or insurance provider has a platform, then you have to use their platform to verify the client that the client is still active. But you put in your information here so that you can keep track of the clients that are using those insurance schemes, and then will help you along the line. So we're done with our setup. Now we can configure our test. So let's go to test configuration or configure test. Here we can add test parameters. We can add test comment, and we can also add test item. We'll go through them one after the other and see what they all stand for. So add test. This helps us to put in all the tests. The system, as we have done, has over 140 test panels, or let me say test groups. So we have full blood count, BF for malaria parasite. It runs through. We'll run through the number of tests. We have the PSA, the testosterone, the hormonal panels are all there. We have the hepatitis C, hepatitis B. We have sputum analysis, the semen analysis as well. We have the liver function test, the parameters and the panel as well, the lipid profile. So almost all the tests that are done are captured in here. However, if there is a test that you do that is not captured in our basic template, then you can always go through and add a new test. So if you want to add a new test, you can always refresh or click on add new test, which gives you a clear form here for adding new tests. So let's add a new test. The name of the test. So let's say we call this one new test. Then the category of the test. Is it a clinical laboratory or an imaging? Like I said, if it's a clinical laboratory, just choose clinical laboratory. And then the test code is an NT for new test. And then we said, we'll just give it a code. This is a new test. The department, this is going under hematology. Then the test fee is 10 Ghana cedis. The TAT is a 10 around time. So this helps us to, the system to calculate how long the patient will have to wait for his results. So we're going to put, say, 10 minutes here. The clinical notes for that test, if there is any clinical limitation or physical limitation to the test being conducted, can be added under the clinical notes, and it will appear in the test report so that the doctor or the prescriber who requested for that particular test will actually have a fair idea in interpreting the results against what the test is. Then the request format. We have format 1, 2, 3, 4, 5, and then no format. Usually no format is used for the imaging test. So if ultrasound and other things, there's no format. Format 1 handles the panel test, things that, or test that comes with the parameter, the test, the flag, or test that you need to flag as to whether it's high or low, and then with the unit as well. That is test 1. Test 2 also comes in with a test, parameter, and results with no flag. Test 3 allows you to put in the format that falls in line, like the blood form comment, where you need a test and then the parameter and then the results. And then format 4 also follows suit for tests like the liver, tests like the, we're looking at tests like weather tests like BF and stuff like that. They are format 4, and then format 5 also follow in suit. We'll provide details of each format and what they do in the various tests. So we're choosing format 1 because we want to add a flag to this new test that we're looking at. And then we submit. Once we submit, it is added to our test. We can always search it here and say new test. And this is the test that we added. It is a new test. The test code is NT. The department is hematology. And then the results format is 1. We can add as many tests as possible if they are not in our basic test. So like I said, if you look at our basic test, we're looking at close to 233 tests, and that is quite a huge number. Almost every test that you can think of is captured in here. Now we can go back to our configuration test and look at adding test parameter. So test parameter will allows you to set up how the various components of the test that you've added should look like. So for example, we know full blood count, you have the WBC and the differentials, you have the red blood cells and its also parameters, and then you have the other smaller cells itself. So if you want a format and how you want your results to look like, this is where you do it, the setup test component. So let's look for a common one that we know. So full blood count. If you look at full blood count, this is how the components are. So there's a WBC or white blood cell count. We have the SI units and the reference value for child, for adult female and adult male. Lymphocyte, it gives you the code, and then you have the unit, and then the reference value for adult male, adult female, and also for child. It goes through all the parameters that you have. So if it is a 20 panel like this one, you have, if yours is less than the 20 panel, you can always edit and then delete to make your panel look straight with it. Okay. So that is for full blood count. Let's look at the test that we just added, which is new test. Yes, it's here. So new test, we've not had any parameter or component added. So we go in and look for a test parameter. Let's say new test is only WBC. So white blood cell count. And then we have the SI unit. Of that one, we're going to use any of this for that, okay? And then, okay, let me use hemoglobin. Okay, so hemoglobin, good. The SI unit, nanogram per milliliter, okay, good. And then the general reference, if there is no specific reference for male and adult, another one. So let's put in anything there. We're looking at 10 to say 15. We're setting up only for child, but you can set up for adult. Say adult male, we're looking at 11 to 16. I'm just using this as an example. It may not be the actual range because the new test that we're setting up. So we're looking at 12 to a 15. And then we can add parameter. So once we add, the parameter we added was hemoglobin under new test. The code is HGB, the unit is here, and these are the reference values that we have. We can do for all the tests that we have. So you could see for clotting factors, you could set up your own parameter. We could also look at the liver function test. The parameters are already set for you. Then we could look at renal function test. The parameters are also set up. We could look at BF, okay. So thick and thin blood film. So thick blood film, thin blood film had not been set up, but you could also set up based on the one that you do. So we do BF for malaria parasite, we have set up. And then you could also do for weather test. It is also set up there. You could look at your urine analysis, and then you have the setup also done for the component that you know, from urine color to the microscopy aspect of it. Right, so that is for the test parameters. Now let's go back and then look at test comment. So we have various comments. Sometimes when after you've done the test analysis, you want to add comments, and then you want the system to be a bit suggestive, looking at the results you get, so that you wouldn't have to type everything all over again. So we've done put in some common test comments that helps you to actually find your way around. There is anemia, anisocytosis, there is basophilia, elevated SAT, elevated liver enzyme, elevated serum bilirubin. So depending on the results you're looking for, you can always find a common comment here. You can also add your own comment in here the way you want it. So you can put a new comment, you click on add new, and that saves the comment. The comment section will come in when we are adding the results. Okay, so now let's look at the last component in your test item. This is where we add the test parameters. So the parameters that forms the panel, this is where we add them. From WBC, all of them for blood, urine, and all that. You find all the parameters in here. And then we have put in a basic parameter for you. At the moment, we have 184 parameters. And all these parameters, you will need them to form the panel. So if you're looking at full blood count, then the WBC, the RBC, the lymphocyte percentage, the site percentage, the neutrophil percentage, the neutrophil count, and all that will be needed to form the full blood count panel. If you want liver function test panel, we could also look for AST. So these are AST, ALT ratio. We could also look for ALP. It's also here. We could look for AST, we just did that one. We could also look for ALT as well. So depending on the parameter you could look for, you could also look for potassium. Serum potassium is there. You could look for chloride. The chloride is there. So whatever parameter you have, you can also search it. If it is not in the list, then you can add a new parameter. Now, in adding a new parameter, you want to add the name as it is, and then the common name you want it to appear on your results. So, for example, the test name is white blood cell count, and then you want WBC to appear, in which case the name of the test item will be white blood cell count, and then the item common name or code will be WBC. That means when you print your results, it's WBC that will come in place of white blood cell count. If you want white blood cell count to come, then the test name and then the common name or the code name should all be white blood cell count. Okay, so we've done with our test configuration. Now let's look at adding our staff. So if you have multiple or workers, you want to add them and assign rules to them as to what they can do with the platform, you go to your human resources, and under human resource, you click on staff. So under staff, we have all this information in here. You could go to add new staff, and then you put in demo staff. The name is demo, the username is demo. You give the person, you assign the person's phone number, and you give him a password, say demo at 123. Then the user type is very important. Is a person an administrator? Is he a doctor? Is he a laboratory scientist? Is he a receptionist? Is a person an accountant? Is a person a phlebotomist? Is a person in charge of the lab? Or the person is a sonographer? So we're looking at the person is an administrator. Then we'll assign the person's email at gmail.com, and then the branch the person works in. So he works at the main branch. Then we click. So anytime we come in, we can look for demo, and we have our demo person we just added. Because he has not logged in, we know his login detail is empty. So anytime he logs in, you could check at what time did your staff log in. So if there are any issue, you can go into their login information and find out who logged in at what time, and then you'll be able to track what happened at that particular point in time. So that is there. If you want to change a staff password, so a staff had forgotten his password, he need to reassign a new one. You only go to your Human resource, you click on staff, just as we are. And then on the option column, you click on the red cock symbol, and then you have edit, change password, and delete. So we're going to change password, and we're going to give a new password. So the new password is new demo at 123. Remember the old password was demo at 123. So we can show the password is new demo at 123. Right, then we click on change. That changes the password for the person. Right. So now that we've done with all that, let's go through the daily operation, how the operation works. Right. So we begin with the front desk. You go to front desk, then you click on new clients. The new client is used to register a new person. If you already have a person in the system, you can always search for the person. So you can click on the existing patient section. The database tells you the existing patient is 0. That means we don't have any person in the system. But if there were people in the system already and you want to be sure the person you are registering this time around is already in the system, you only put in and search for the person's name. So Dr. Daniel, and you say no results found. That means the person is not in the system. Alternatively, you could also click on the open patient list, and then that gives you a list of all the patients in the system, and then you can search for them here. You can also view all the patients in the system. If there are many, the system takes time to load all of them. And if there's no patient found, it tells you no patient yet have been added here. So let's go to the add new. So front desk, new client. And that's what we do. We take the patient information. So we say this patient is Daniel Kwesi Kovo. And then the patient is a male. The date of birth, we can set with the date of birth or age. Whichever we use, it will do the calculation automatically for us. So for example, let's say this, our patient is 42 years. It gives the date of birth as 1982. The day and the month can always be changed. The system will work with the current month and date to calculate the date of birth. So the person knows his date, the day or month, they can put in the day or month. So let's say this person was born in February 1982, but it was on the 10th, it will still do the calculation for you. The date of registration automatically assigns for you as today. The contact of the person is done. The email, you put the person's email there at gmail.com. And then the WhatsApp number, that helps you if you want to interact with the patient on WhatsApp, which is a feature we will add onto the platform very soon. Marital status, the person is married or single, you put in there. And then residential address, you put the person's address there. Occupation, we say he's a medical practitioner or whatever occupation. Emergency contact, let's say Mrs. Dan, the contact of the emergency person, then we choose a contact. Then the relationship, we say that's the wife or the spouse. Then if there's a need to add a photo, you want to take a photo. If you have a webcam, you can use that one to capture the patient picture. But if you don't, you can also leave that one and then you save your record. Once you click on save, it generates a pathology number for the patient, and then it generates the patient number. So this is our first patient, this is a part number. This is how our part numbers are generated. It uses the date as we have it, and then it will give us the other information. So we are in 2024, it's a month of January, and then it will count the number of cases we have in January. So if you see a number like this, it is 2024, 01 is a month of January, and 000001 means that is the first client in the month of January. Then you have to request the type of service the person is doing. So when you click in, is it a personal or working? Is it the person referred by a doctor or is transferred from another lab? So if the person is referred, then the system will allow you to pick the doctor who referred the person to you. And if the doctor information is there, you can easily pick the doctor information. If the doctor information is not there, then you can also add the doctor information. So we have the doctor information in here, Dr. Dan from Damango Government Hospital. We select, he referred this patient to us, and the sponsor section, we choose whether the patient is paying by cash or by insurance. So by cash or insurance, we choose whichever the patient is paying for. So let's do cash payment. And here's where we add the test the person is going to do. So he's going to do full blood count. The person is going to do without test. You just type in, as you begin to type, it will filter and give you the information. The person will do BF for malaria. And once you put in, it automatically calculates or gives you the bill of the person, the individual cost of the test. If you make a mistake, you can always delete and then re-enter it. So we deleted the weather test. We can always re-enter the weather test or any other test that we want. Right. So the total bill for the patient is 80 Ghana cedis. Now, the turnaround time, this is where we have full blood count is going to take 15 minutes waiting time. BF is going to take 15 minutes, and then weather test is going to take 20 minutes. So mostly we'll choose the highest waiting time to be the estimated test time. So we'll put our 20 minutes here, and then the mode of results delivery. Would a person want his results by email? Would you want it by pickup or want to be sent it through WhatsApp for the person? So we choose pickup, which is most of the common way that it is done. And then we submit the bill. Once we submit the bill, it takes us to the payment of bill section. It gives a breakdown of what the person is doing. It generates a billing number for the person. And now we have the billing details. 80 Ghana cedis. Is there application of discount? Are we applying discount for the person? The system is said that it's only person assigned as managers or administrators or accountants that can apply the discount. So if there's no application of discount, the staff going through the process cannot apply discount. As you can see, I'm attempting to change the discounting, but it will not change because that is not how it's been done. So if the person is paying all with no discount, straightforward, you go to payment method. Is it by cash? Is it by mobile money? Is it by bank transfer or by a check note? So the person is paying by cash, and then we confirm payment. Say payment has been done, and then we have our receipt nicely developed with the laboratory information in here. We have the patient information, the test the person is doing, the total bill, the amount the person paid, and then if they are debt or discounted amount, you could always print your receipt in whichever format. If you're using a point of the POS printer, you could always do that one. So if it's a POS printer, mostly you have those ones in an envelope DL or envelope number 10 size. So if it's envelope number 10, this is how the receipt will appear, and it's printed nicely for the patient. If you want to print them also in an A4 or A5, you can always have it. This is an A5 format, and then you could also have it in an A4 format, whichever way you want to. You could also print them to PDF. And then if your printer is network, you can also pick up a network printer and then print through there. So once you finish printing, then you can go back to your billing. So we have no pending billing. We've added a patient in there. We have a service requested for that patient. There's no service pending there. The person has been moved from, after registration, billing has done, our next stage will be going to test processing. So we'll go to test processing. Then we'll look at processing of the test. We have on the left side, the service requested, the number of patients who are there, you have all of them. And when you come to the page the first time, there is always a notification at the bottom right corner that tells you the number of patients who are waiting. This notification pops up from time to time, telling you the number of patients who are waiting, so that if your laboratory facility is bigger, and the sample collection point is far away from the registration point, the person at the sample collection will always get a notification on his system that a patient is waiting. Once you click on the name of the patient who is waiting, you have the test panel of that patient showing. So this patient information comes in. It tells you the number of laboratory requests that came in is 3. There is no ultrasound or imaging request, so it's 0. And then you could see the breakdown from the tab tables here. So laboratory request 3, ultrasound request is 0. And then you have the details of the laboratory request. It gives you the sample tubes to use for the collection. This is hematology. The primary tube is a purple, the secondary is a red. So we have the same thing for whether the tubes were not set. That is why you find it this way. So after taking the sample, you have to process each request. So when you take the sample for hematology, for serology, you just process by clicking. It tells you which sample you are taking. Is it blood you are taking, a urine, stool, sputum, saliva, whatever sample that you are taking. So this is blood. And then you click on sample taking. It tells you a sample has been processed. Now we don't have 3 in here, it's remaining 2. Now we process also for the BF, it's still blood we are taking, and then we process it. We have hematology, we click, and then we choose blood again, and then it is done. So we don't have any patient waiting now. We're done with the patient. So the notification comes 0 patient waiting. Now let's move on. Under test processing, we have completed processing. So we can look at the process requests that we've done. There are 3 requests that we have processed, all for the same person, and these are done. The status are there. We have sample taken, or the sample had already been taken, so we could see it from here. Now the status are all sample taken. Now after processing, we go to test analysis where the test is actually done. So we click on test analysis. Is it a laboratory or imaging test? So if it is an ultrasound unit, they will click on imaging and they will see all the ultrasound requests assigned to them. If it is laboratory test, you click on the laboratory and then you check on the left panel for the patient list. You have the name of the patient in the waiting list. If there are 10 of them, all the 10 names will show on this side. So we click on that one, and then it opens the test analysis form for us. It also gives us a breakdown. Laboratory analysis is 3, pending the analysis. And then the results available is 0. So we've not added any results now. So we look at the tests that are ready for analysis. We have hematology, 2 hematology cases, BF, and then the full blood count, and then 1 serology case, which is a Wilder test. Now we have a turnaround time, reminding the person doing analysis that this is the estimated turnaround time. It can always be edited so that if there are changes in the output, we can always make those changes within our template. So let's look at it. In adding results, after running the test, we want to add, say, our full blood count results. We click on the plus sign under the results column, and then it will open our panel for full blood count, where we have the parameter, the results, the flag, and the reference. So we have the white blood cell count down up to the platelet large cells ratio. So let's begin putting in some results and see how it flags. For WBC count, the reference range for the 41-year-old male is 5 to 12 per the panel template we are putting there. Like I said, the template can always be edited to suit the results or the machine you are using and the reference that are assigned to it. So we're going to put in a value less than the 5 and see how it will go. So we'll put in 4 and it will flag as low automatically for us. We don't have to think of whether 4 is bigger than or is out of range or within range. The system will do that calculation for us. Now let's put beyond the upper range, which is 12. So let's put, say, 13, and then it gives us a flag of H in red. So you notice the colors. When it's low, it's a blue color, and when it's high, it is also a red color. So let's put in, if it is within the range, it doesn't flag. So we have within the range, it wouldn't flag. We have within the range, it won't 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 flag. We're adding this test randomly. So we're putting in test, potentially put this to flag, and then we put this also to flag. We'll put this, then we'll put this, we'll put this, we'll put this, then we're putting this, we put this, we put this, we put this, and then we put this. We put 1.12 and then 14.0. So once we look at it, we're looking at, we're having a high HB. So if we're looking at maybe a case of polycythemia, we come in here and then we look for polycythemia. So once we add, it adds the comment for us. Okay. Or we can begin to type it ourselves. So high AGB level suggestive of polycythemia, depending on how you want to put it. Or if you want to use a predefined comment, you go in and then type in this is a polycythemia case, and it automatically will add for you. If it is anemia, you add, it will come. If it is the polycythemia we spoke about, you add, it will come. So this is a polycythemia case, and then we can then add our results. So this is how our results will look like for preview before we print. We have the logo of the medical facility or the laboratory facility, the address details also provided, the biodata of the patient we're dealing with, and then the test panel. Clinical notes over there. Then we have the entry by the person who entered the results. Automatically, the system assigns the person's name. And then you need a validator and then a signature for there. You can always edit. This is for the analysis state. So the person doing the lab can always preview his results, make sure they are intact. If they are not, he can go back to edit them and they will load a template. Let's say this was flag, so 13, and then he can come back and then submit. Once he's done, you can go back and then you have one resource ready and now remaining two for analysis. So you go and add your second resource, BF for malaria parasites. You click on it, it gives you the template, thin blood film, the parasites per microliter. Let's say you had 120 parasites per microliter, and then we want to put malaria parasite seen, and then you submit. So we have it in here. Also the same format as we have seen. The comment is done malaria parasite seen, and it's 120 parasites. You can always edit it, and then you can go back to A. So now we have one analysis remaining and two results are ready. Then we can click on the last one where we have our weather template or panel also loading for us. So the anti-O and then anti-H. So let's say we have one H2, say 80, and then we have one H2, 120. Okay. So we can look for any comments about typhoid if it is there. If it is not there, we have to add. But any comment about weather, we don't have a comment on weather, so we'll leave it that way. But if there was a comment on weather, we can add a comment. Okay, so we can say higher, tighter values suggestive of salmonella infections. And then we submit, and then we have our comment being added. And then because there is a clinical note added to weather test, then we have those clinical notes added, and then entry by validated, not yet, and then the signature of the person who signed. So we'll go back and see our panel. There is no test waiting for analysis. We can always go back to our main test analysis, and then we'll look at completed test analysis. These are the tests that we have completed. At any point in time, we can edit our results if we feel we've made some errors, or if we are prompted by our laboratory in charge that we've made some errors, we can always go back and do the needful corrections. So let's see, the next will be results validation, which mostly will be done by the laboratory in charge. So we go to results validation, then we'll click on validate results. Then it also brings us a panel awaiting validation. You have a list of patients who are awaiting validation. They all will form on this panel, and then you click on the patient you want to validate the results, and it will tell you the number of lab and the number of imaging or ultrasound requests. So the number of lab results ready is 3. There is no ultrasound, so it's 0. So we can go through them one after the other. So we have full blood count, BF, and then weather. Now let's validate full blood count. We'll go to the action and click on the tax icon there. Once we click, it will bring us a validation that gives the person doing the validation the opportunity to proofread the results to be sure the flagging and then the numbers are entered right, and then look at the comment also and make sure the comments are well. Once that one is done, then you click on validate results, and it will validate the results for you. Now we have 2 out of the 3 remaining. We'll go through the next one, and then we'll look at 120. We want to add parasites per microliter that way, and then we validate the results. We have last one, so we want to validate that one to check to be sure everything is intact, and then we want to make this capital, and then we validate the results as well. So there's no patient waiting, no results ready to be validated. So we look at completed validation, and then these are all results that we have complete validation. And once we've completed validation, we can go and print these results in here. So it preview for us, and then we can print the results in here. We look at it, the entry by is the person who did the entry. That is the person who has currently logged in, and they're validated by, it's mostly advisable that you have 2 different people, one doing entry and one doing validation, because it wouldn't sound professional to have the same person doing entry and the same person's doing validation. Most of the times, prescribers or doctors who request for this lab will be worried that there's a lack of quality control check or measures at the facility. So to sound a bit professional, always have one person log in to do the analysis and the results entry, and one person proofreading the results to validate them, so that you have their names appearing on the results. It looks more professional, and you make your work much easier for you. So these are the completed validated results, and the status are now results ready. We have them, 3 of them. We can print them individually from here, or we wait when we go to the next section, test report. So patient report, we can click on patient report. Then we have on the left panel, report ready. We'll give a list of patients whose reports are ready. You click on the name of the patient, and then you have the report that are ready. So this patient has 3 tests, and all 3 are ready. They are all laboratory. There are no imaging reports, and these are the reports that we just did. The person who did the validation's name will be on it. So as a quality control measure, when the results are going to be printed, especially if they are printed at the front desk, then the person who is going to do the printing should check whether the right person to do the validation had actually done the validation, or the person who did the test entry or results entry had actually validated himself, which will be a duplicate of his name on the report format. So we can print the individual report or print all of them. So we can print only full blood counts that preview the report for us, and then we print it. On whichever form that you want to print it, you can have it. So this is how nice it will look in the colorful mode. If you're using a color printer, that will be excellent. If it's not a colorful printer in the black and white, you will still have it nicely packaged in there, and then the appearance will be good. So I want to preview the black and white for you. This is how the black and white will do. You could always set your margins or just leave it as set to fit in A4 sheet size perfectly. Okay, so this is it. Then we could also print the BF that comes in this way. If we print, you realize BF comes in and there's so much space waiting for you at the bottom here. So you mostly will want to combine the tests together. So for example, we want to print all the 3 tests together. So we'll click on the print all, and that previews all the 3 tests for us. So our first test is the full blood count. It always tells the specimen or the sample that was taking blood. The BF follows suit, and then the weather follows suit. So we can click on the print report, and that previews all the 3 reports for us. So we have full blood count at the top, and then we have the BF. So let me set to a color printer, or let me to PDF, and then we'll have it done that way. So full blood count goes on 1, and then we have the BF, and then weather on another sheet. That saves you paper, and then it's very economical, if I should say that. Okay, right. So we're done with the test report. If you print, you'll have the results ready. Anytime the patient comes back at anything time, you can always print the report for the person. So let's go back to test report, and then we check on test report. And it will give a list of all the reports that has been ready, and then you have it in 2-fold. If you want to check the person's previous reports against current reports. So if the person had been there before, you have all his current reports here, and all his old previous reports will be under this section. So if you click, it tells you there is no previous report by this patient. But the current report, there are 3, and you can also print from here. So anytime the patient comes back, maybe after a week, after a month, after years, you want to, oh, I did a test here some time ago. I don't know if you can help me with the results. If the lab has a policy of doing that, then they can go into the record. The data will be sitting there, and you can have it printed for the patient, either at a fee or for free. So let's see. That is for test report, and that takes care of all the test operation that goes on in the laboratory. So we have done client registration, we have done billing, we've done test processing or sample collection, we've done the analysis and results entry, we've done validation, and we've also done report printing. Now we have collected some money. Let's look at how our financial status stands now. So we'll go to finance, and we'll go to our financial dashboard. Our financial dashboard gives us a summary. The number of attendance we had today is 1. The number of samples collected is 3. Total sample completed. Labs, total scan completed is 0. We've not done a scan today. And then total labs completed is 3. We just did 3 labs. And then it gives a breakdown. Total attendance, not today or general. And we have total patients in general. And then the number of tests and scan profile you have in the system as of now is 148. Supplies, we'll talk about that. So you could always check your attendance. You could check your invoices. You could check your receipts that has been given. You could also check your revenue report, your test revenue report, your doctor's report, your expenditure report, and your consumables reports. So we have a chart of your revenue for this year. For the branches, we always select all your branches or the main branch. If it's a one branch, always do a main branch, and that will give you the show. So we've only collected 80 Ghana cedis this month, just today. And then you get your statistics for the month. Number of patients for the month is 1. A new registration is 1. Total revenue collected is 80. Total claims with insurance is 0. Number of laboratory tests that has been done is 3. And then number of sonography tests or scan tests is 0. Then the top test that has done is full blood count. That is 1. So the last panel gives you the top test report. So it's more or less a test leak for the month, so that from there you know which test requests had come in more or which tests you have done more. And then if you want to see how your consumables are running with that particular test, you also know. And then you go to your top 6 test completed. It's also like a leak. You have your consumable stock level below the level. We've set level at 20 quantities. You can always change the quantities. And then items that are expiring, always set at 3 months alert. So that will give you an alert within 3 months if an item is about expiring. Since we have not put items or consumables, we have no alerts or consumables alert here. Okay, so let's check the buttons here. Attendance give us the attendance we have for today. We could choose the service, whether it was insured or not insured. We could always set the date range from to, so let's say we check yesterday and then we filter, there's no data available. But anytime we check for today, since we did for today, it will give us the data. It will give us the name of the person, the service the person rendered, the charge that was taken, the payment status, and then we can always have a view of what a person did. Let's go back to the dashboard and look at our invoices. So invoices that we generated today, this is for this patient. The status is paid. The invoice was generated by this staff, and we can always view the invoice and then cancel when there is a need. This is only done by the accountant or the administrator. Nobody can do that. Okay, so let's go back. We're looking at our receipts, just same. We could choose the patient and then we filter by the patient. We have the patient information. This is it, the amount the person paid, the payment mode, the receipt number, who received the cash, and then if we have to print the receipt again at any point in time, we can come in and print the receipt at that any point in time. Right, so let's do this. And then let's go back to the dashboard. We're looking at revenue reports. So we're looking at revenue report in the same way. Under the revenue report, we have an additional component, the name of the patient and the number of tests that patient did, the amount he paid, the doctor who referred that test, and the branch that did that test. So that if you have a multiple branch, you know which branch is working and generating more revenue and which branch is not generating more revenue. You can always search whether this test was insured or non-insured. Okay, then we could also have a test report that gives us the individual test component and the amount is generating. So if we want to find out how much full blood count is giving us, we'll filter by full blood count, and then we know. If we want to know how much BF is giving us, we could also filter and know how much BF had given us for a period and also within a branch. So you have that flexibility with the report filter. We could filter by the test name, we could filter by the branch, and then the date on or from, and then to that particular date range. Okay, now we've done the doctor's report. We could go in and find out the request that you've had, how many doctors are giving that request. So you could select filter by your doctors who only had one person in, the branch, which branch is getting more referrals, and then you could find out the dates to and fro. And then the table gives you access to this information. So you know the referring doctor had been this person, or this Dr. Daniel had done this referral for us. Now we can also export this information to Excel if we want to further analyze it and then keep it, maybe a hard copy of our report. That can also be done. Then we have our expenditure. We've not done an expenditure yet, but if there was an expenditure to do, then we could do the expenditure. You select your category of expenditure, whether it's an outsourcing, that is if you're referring your lab and some of your tests to other partner labs to run them for you. And then expenditure items like fuel, like repair of bike, meals, entertainment, laboratory materials, imaging material, methodology analyzer, scan machine, air conditions. You can add the category from here as you want. So you can add it from here as you want. And then you can also filter your expenditure report to find out which item is giving you more expenditure. Then you have your consumable item. The consumable item will be handled under inventory, where you add in the items that you use at the lab, and then you can issue supply to the branch and then monitor the flow of the supplies. We'll do that one under the inventory. So far, I think we will pause here for today. The next video will be looking at the inventory, how we do the inventory, how we add the various items to our branch or our system, and then how to issue them through the consumables form and the likes of that. And then we could also take time to look at our notification system. But let me take a quick one. I think I will handle that one quickly. So notification system, if you click on the notice board, if we want to send message to all the branches or only staff of the main branch, we'll click on the main branch and then we could send a message. There is going to be a new training on the new software on Friday at 9 a.m. And then, okay, so there's going to be a training, okay, on that, and then you send a notice. Once the notice is sent, you have a history of it, and then the notification bell turns. So once you click on the notification bell, the message comes. All staff logged in at any time, whether at home or wherever, will see this notification and the message is sent to them. The staff cannot send message across board. We have done in such a way that it does not allow staff to staff chatting, because our experience and research shows that it actually does not help to make the system efficient. People spend time on the platform chatting rather than doing work. But for flow of information from management to staff, vital information, the notice board is key so that information can be disseminated across board to everybody as and when it's needed. So thank you so much for the time. Like I said, the second video will surely look at the inventory aspect and the supply aspect. Thank you.